So this year, 75 senior doctors and consultants issued a statement raising serious concerns over management and safety within our health services and the impact this has on staff. That letter was very similar to a letter written by senior consultants in 2012, 14 years ago. We've also seen the suspension of elective procedures and an announcement that Nobles is unable to deliver comprehensive care, the whole Opal 4 situation. In 2019, the opening paragraph of the Sir Jonathan Michaels report noted that several previous reports had also made good recommendations which were not fully implemented, and hoped that the same thing wouldn't happen with his report. Which, of course, is exactly what has happened. The commissioning and shelving or cherry-picking of reports is a very common problem with the Isle of Man government, which again points straight back to the root problem within the structure of government itself. As of spring 2026, only 12 of the 26 recommendations had been completed, 3 years after the entire process was supposed to be done and dusted. Isle of Man government has cherry-picked the highlights in order to make it look like something is being done, and dragged its feet on the really difficult bits, which the report said would be really difficult. It's easy to see how this approach has actually made the situation worse for the frontline workforce. Working in frontline healthcare is hard enough without feeling like your employer doesn't care or is actively exposing you to unacceptable risk and pressure. Our people need to know that they're in a team that has their back. You cannot build a confident and committed team which knows and understands the community it is part of by treating people like dirt and plugging the gaps with agency staff. We cannot blame Manx Care when the structure above it has dictated the terms of implementation and ignored the recommendations made to set it up. The lack of accountability trickles down from the very top. If we do not address this, we cannot reasonably expect good care. The Isle of Man needs a much wider debate about what we want and what we can afford. We always hear that the health service is too expensive and keeps overspending, but the hard fact is we spend significantly less per capita on healthcare than the OECD average. Why is this never discussed? Are we happy to accept the denied but obvious ushering towards privatisation, knowing that that will significantly increase the cost to society as a whole by adding a profit margin to everything which won't stay on the Isle of Man? Issues such as GP services and residential care, sheltered housing, dentists for the West have to be a well-defended part of the debate, but it's pointless promising anything unless we deal with the bigger picture. We need to listen to and back our workforce first. The West will be left begging again unless the entire system of funding and budget prioritisation and management is fixed. The current system of government has proven over and over again that it is not capable of fixing this. Are we ready to change it?